How do antipsychotics work for OCD? Imagine trying to quiet a noisy room filled with obsessive thoughts and compulsive urges. Sometimes, the first treatments like therapy and certain medications don't fully calm the chaos. That's where antipsychotics can come into play. They are mainly used as an add-on when standard treatments don't give enough relief. Their exact way of helping isn't completely understood, but we know they influence brain chemicals called neurotransmitters, especially dopamine and serotonin. These chemicals help regulate mood, thoughts, and behaviors, and in OCD they often become imbalanced. Antipsychotics mainly target dopamine receptors, especially D2 and D3 types. Dopamine is involved in how we experience reward and motivation, but in OCD, it may also contribute to the development of compulsive habits and obsessive thoughts. Drugs like risperidone, which bind strongly to dopamine receptors, tend to be more effective in reducing OCD symptoms. This suggests that blocking dopamine activity in certain brain circuits can help lessen the compulsive behaviors and intrusive thoughts that define OCD. Many second-generation or atypical antipsychotics also affect serotonin receptors, especially the 5-HT2A type. Serotonin is another key neurotransmitter involved in mood and anxiety regulation. The interaction between dopamine and serotonin systems is complex, and sometimes blocking serotonin receptors can have unexpected effects. For some patients, certain antipsychotics with strong serotonin receptor activity might even worsen OCD symptoms, which highlights how nuanced and individualized treatment can be. Neuroimaging studies show that antipsychotics can change activity in brain areas like the striatum and anterior cingulate cortex. These regions are involved in controlling compulsive behaviors and obsessive thoughts. By normalizing activity in these circuits, antipsychotics may help reduce the severity of symptoms. In practice, antipsychotics are usually added to selective serotonin reuptake inhibitors when patients do not respond well to these medications alone. Common choices include risperidone, aripiprazole, and haloperidol. However, they are not without risks. Side effects can include weight gain, sedation, movement disorders, and metabolic changes. Because of these potential issues, doctors carefully weigh the benefits against the risks before prescribing them, and they are typically used in cases where other treatments have not been enough. It's important to remember that while antipsychotics can help some people with OCD, they are not a replacement for primary treatments like exposure and response prevention therapy. Often, optimizing medication doses or combining therapy approaches is the best way to manage symptoms. In summary, antipsychotics work in OCD mainly by affecting dopamine pathways and sometimes serotonin to help calm overactive brain circuits involved in obsessions and compulsions. They are used as an additional tool when first-line treatments aren't enough, but always under careful medical supervision. If you or someone you know is considering this approach, it's essential to consult a healthcare professional to determine the safest and most effective plan tailored to individual needs.